Once again, thanks a lot. It's a great honor to be here amongst you and discuss about my favorite topic, about how to not be here, to prevent all that we're talking about. Yes. I think that's what we need to try to achieve. And indeed, this title actually, well, the objective in this title comes from, I think, a very well-known oncologist, Yannis Bukovinas from Thessaloniki, my co-citizen, who actually, when we were talking about prevention and overall cancer management in Greece, he was talking about cancer-free cities. That's what we need to achieve. And I think this is where we really need to go. I was last week, just before Easter, at an One Health Summit organized by President Macron in France, in Lyon, together with IARC as well, talking about how One Health connects to, of course, human health and prevention. And I think this is important to be able to actually achieve in Greece as well. So what's the challenge? Well, the current urban cancer challenge, since we're talking about cities, if you look at the data, we do have not only smoking and, of course, drinking alcohol. By the way, NHRF, together with Yale, is organizing a conference in Edipsos on alcohol and cancer in May, which I think is very relevant. But indeed, the quality of the urban environment is a major factor. You know that IARC has classified outdoor air pollution and actually fine particles, PM2.5, as group 1 carcinogens in 2013 already, linked not only to lung cancer, but also breast, liver, head and neck malignancies. PFOA, legacy chemicals, forever chemicals, are upgraded to group 1 carcinogens in 2023, and acrylonitrile as well in 2024. And we all know that climate change actually is expected to amplify cancer risk, for instance, via wildfire, PM2.5, and that is something that Greece, unfortunately, and Portugal as well, and Spain, the whole of south of Europe, it actually has to suffer from. And that will become more and more dramatic as the climate crisis unfolds. And finally, that last bullet, I think is very, very important. 70% of global cancer deaths actually are linked to low and middle-income countries. This is where prevention infrastructure is the weakest, and their prevention infrastructure is a key determinant, actually, of the final outcomes. If we look at it from an exposomic perspective, so the totality of exposures, we actually see that One Health can integrate human, animal, and ecosystem health across the continuum of cancer. There's a lot of commitments, even as recently as just the week before Easter, very significant commitments, both financial and political, by heads of state. It was a summit meeting in Lyon. We have, on the scientific front, established a global exposome forum to try, together with colleagues from the US, Japan, the Global South, to actually try to create an alliance that can really not only bring about the best science and sort of decipher the links between environmental exposures and human health, in particular with cancer, but also try to engage politicians, policymakers. We are creating an exposome alliance at the European Parliament, a multi-spectrum political spectrum entity, which actually is there to try to incorporate this kind of preventive and precision prevention thinking in European policy. We're working with colleagues from Johns Hopkins, for instance, and Lund on essentially creating the possibility to have risk assessment tools, specifically looking at multi-carcinogen interactions and tissue modeling in this exposograph platform that you see here. This is going to come out in the next days, actually. And we're looking at what we call translational exposomics as an enabler of precision prevention, to have the right intervention applied on the right population at the right time. Now, having done all that, we have actually just finished recently a very big project on the urban exposome. And what I really would like to highlight is the first and the last bullet here. The first one is what I think is really the most important, and we don't usually talk about it, but we saw that having a really exposome-wide association kind of study, we looked at equity as being a very, very important determinant of cancer risk. So cutting inequity first would be the key message here. And I think this year, which is a political year in Greece, a pre-electoral year, it's a fundamental message to pass to everybody, private sector, public sector, politicians, scientists, and civic society. The last one is more about how to make the link between what science does and how we can use enhanced scientific information to inform and control policy, monitor the effectiveness of policies, because indeed accountability is a key factor in public policy. So we have identified a panel of 4 biomarkers, ascorbic acid, choline, exposure factor 10, and L-tyrosine, as being able to actually capture, together with stress response genes, how the exposome, internal exposome changes and how physiological response changes with changes in the exposome. So we can actually use this panel to measure the effectiveness of public health policy, which I think is very innovative if you think about it. It just takes, we heard a lot about the tremendous transformation in the public health sector in the last few years, which indeed is the case, but maybe now is the time to actually incorporate also in novel omics-based tools. I just wanted to highlight, to juxtapose what we're talking about with gene therapy as being, if you like, the downstream lever for combating cancer. You see a number of technologies here. I don't want to tire you with this, but what's important is the last bullet again. Prevention savings can actually cross-subsidize gene therapy, and gene therapy costs actually mandate upstream prevention. I think this kind of connection, policy-wise, is fundamental to think about where to gain the money that is required to develop new novel treatments. Well, prevention is a very effective way of doing that. And if we can do this in an evidence-based and science-based manner, that can really work. Finally, again, I'm trying to be okay with the time, Lester. I just wanted to highlight, because Yannis Bukovinas asked for this cancer-free city blueprint. And that is an answer to a number of issues that were mentioned earlier, ensuring that the air quality guidelines of WHO are actually enforced. Right now, Greece and Athens is actually at the European Court of Justice because of the fact that we do not manage to do that. Regulate forever chemicals, PFAS, endocrine disruptors at city level to cut exposures. I would say deploy this exposome-based surveillance where we can integrate city-specific biomonitoring on the human population together with health response monitoring and health registries. Something that right now, with the informatics infrastructure that is being put in place in Greece, can be done in Greece right now, not only in other places in Europe. Embed safety and sustainability by design principles in urban planning, in construction material selection, in consumer product regulation. And there the public sector can be, because of the fact that it's a tremendous purchaser of this kind of material, can be a game changer. Scale a number of partnerships, CCAN, Partnership for Healthy Cities, to beyond 100 cities by 2030, but also look at the gene manufacturing hubs in low and middle income countries. I know that South Africa, for instance, is doing tremendous work on this, and of course there's need for policy alignment on a number of issues. The EU Beating Cancer Plan, the Mission on Cancer of the EU, the non-communicable disease targets of the WHO. Just to close, population prevention in this sense is what I would call the population lever, and gene therapy the individual lever, but both are actually essential. So the question to me is no longer prevention or innovation, but rather governance for both simultaneously, so that we can actually really optimize and bring about the necessary change to combat really cancer.